Every woman should know how to check her breasts for lumps. It's simple, quick, and can help you catch changes early. Today, I'll show you exactly how to do a breast self-exam at home, step by step, safely and confidently. Most breast lumps are not cancer. They can be cysts, hormonal changes, or fibroadenomas. But early detection saves lives. A self-exam helps you know your normal breast texture. Notice any changes early. Feel more confident about your health. The best time to do this? 5 to 7 days after your period, when breasts are least tender. Stand in front of a mirror with your shoulders straight. Look for changes in breast size or shape, dimpling or puckering of skin, redness or swelling, nipple turning inward, any visible lumps. Now, raise your arms above your head and look again. This position stretches the breast tissue and makes subtle changes easier to see. It's easier to detect lumps when your skin is slippery, so the shower is a great place to start. Use the pads of your 3 fingers, not the tips. Move in small circles about the size of a coin. You can follow any pattern, but these 3 are the most effective. Circular pattern, start at the outer edge of your breast, move in circles towards the nipple. Vertical pattern, move your fingers up and down, gives like you're mowing a lawn. Wedge pattern. Start at the nipple, move outward like slices of a pizza. Feel for hard lumps, thick areas, any tenderness that is new. A spot that feels very different from the rest. Check the whole breast, the nipple, and the area up to your collarbone and under your armpit. This is where lymph nodes are. When you lie down, your breast tissue spreads out evenly, making lumps easier to feel. Place a pillow under your right shoulder and raise your right arm. Use your left hand to examine your right breast using the same patterns, circles, up and down, or wedges. Repeat on the other side. Apply 3 levels of pressure. Light pressure for tissue just under the skin, medium for the middle of the breast, firm to feel the deep tissue close to the ribs. A lump can feel like a hard pea, a rubbery ball, a thickened area, a ridge that doesn't match the rest of the breast, something stuck in place, or something that moves around. Remember, many women have lumpy or uneven breasts naturally. What matters is noticing new changes. See a doctor or gynecologist if you notice a new lump or thick area. Lump that doesn't go away after your period. Nipple discharge, especially bloody. Change in size, shape, or skin texture. Pain in one specific spot that stays. Swelling around armpit or collarbone. Early checkups save lives. Never feel embarrassed to ask. To summarize, look, feel, know you're normal. Report any changes early. Breast self-exams take only 5 minutes once a month, and they can make a huge difference. Don't forget to like and subscribe for more women's health content.